This is my dad, Jerry. He was 89 when he passed away on the 15th of April 2022. It was Good Friday. Turned out it wasn't such a Good Friday. He and Mum were married for almost 70 years. There's 5 children, 15 grandchildren, 22 great-grandchildren and 1 more on the way. Dad was an aircraft mechanical engineer and a pilot. He loved planes, he loved anything mechanical, but more than anything, he loved his family. Our engagement with Melbourne City Mission came in late January 2022. Dad's health had declined quite suddenly and we found ourselves thrown into this world that none of us had ever experienced before. It was overwhelming, stressful, chaotic. Having the support of Melbourne City Mission felt like a safety net. There were so many health professionals involved, doctors, GPs, specialists, hospital clinics. Melbourne City Mission sort of supporting us through all of that kind of helped pull things together a bit and helped us get through the day-to-day stuff. Dad didn't want to talk about end of life. Mum didn't want to talk about palliative care. So I dealt with Melbourne City Mission myself. I had regular contact with Melbourne City Mission so that I could give updates on all of the appointments that we had, and it was nice to feel like we had that consistent support. I could call them 24 hours a day if needed. They were familiar with Dad and what he needed and could give the specialist advice and support that I needed to be able to support Dad in the way that he needed. For me as the carer, Melbourne City Mission was able to provide counselling support for me, which was incredibly helpful. I met the counsellor about 2 months before Dad died, and she came to visit at home. She was able to listen to me talk about anything that I needed to talk about, my fears, my anxiety, what to expect in the grieving process. We also talked about practical things like self-care and even funerals. The emotional support was really important for me because as a daughter caring for her dad, I also had medical power of attorney, so I was having to have conversations with doctors and make decisions for Dad, which was incredibly hard. It was very hard to do it on my own. And it was stuff that I couldn't really talk to family about because it was so confronting, so hard for everybody, and my emotions were so big. But the counsellor was able to sit with me through all of that while I cried all the tears. And I don't know where I'd be without that support. I would suggest try to be really clear about what is happening. What is happening with your loved one's health, expectations, and try to have the hard discussions about end of life. Things like advanced care plans, what their wishes are, even things like funerals. The biggest challenge that Melbourne City Mission supported us with actually was the night that Dad died. And I think if we hadn't had that support, the calm reassurance from the nurse, there's a good chance that in our panic, my panic, Dad would have gone back to hospital and probably died there. But as it was, we kept him at home and he got to die in his own bed with Mum and my sister and I there with him. And it was peaceful and it was actually really beautiful. And we're very thankful.